Dr. Sharan was with me in Japan for a while, and he studied a lot, very hard. He worked very hard in this field, and now I am sure he is the most top leader in India in this field of functional neurosurgery. So if you had such kind of symptoms, if you think you have dystonia, tremor, Parkinson, you should go to Dr. Sharan.
Dr. Sharan, the way I was impressed, the reason I was impressed is that he provided a holistic treatment. It just didn't end with the surgical procedure. It continued with the patient. He became a part of the patient's journey to be back to their normal life.
Since 2010, I have been interacting regularly with Sharan. At the same time, I met Pratibha because they were very interested in setting up a neuro rehabilitation unit. And I saw that my patients who were referred to them got very good results. And since then, our friendship has bloomed.
It's an excellent job that they're doing. I have been, they inaugurated their neuro rehab center close to Aster CMI. It's a very good thought actually, because they're not only looking at rehabilitation, they also have an Ayurveda sector with them.
I know Dr. Sharan for many years, and he was a budding neurosurgeon. However, he developed his skills so fast that over few years he became an expert, especially, and then he meanwhile went on to get his training in movement disorder, and he has been doing extremely well in movement disorder. He has established a running rehabilitation center with multi-modality specialities that are available in one roof, and his better half is involved particularly in the movement disorder rehabilitation, and he has got all the facilities for his center where a person with stroke, especially neurological illness, stroke, movement disorder, any other neurological illnesses can seek all rehabilitation specialities in one room.
Today we know that there is a lot of input, electrical stimulation, biofeedback, encouragement, all that is required. So all that has been taken up over by, I think Sharan saw it very early that somebody has to drive it. And why not a neurosurgeon? Because none of our treatment is complete without rehabilitation, as I already said. And he and his wife, they have together taken up the concept, brought up all the new things that are being done all over the world.
I know Dr. Sharan Srinivasan for the last about 15 years. When he was a just young budding neurosurgeon, he's a very passionate guy, was always interested into something to learn new and profess in excellence in one of the field. He set up initially a small unit where he concentrate on the surgical procedures in various movement disorders, particularly the dystonias, and he has excelled in his work, and he did a wonderful work, some of them which he has presented showing a remarkable improvement, particularly some of the guitar dystonias, writer's cramp, and some of them very disabling dystonias. He has done a wonderful work and it has improved. One of the greatest aspects of his ever learning, ever smiling, affable and affordable neurosurgeon for most of the patients.
They are wonderful people, wonderful human beings, and more importantly, I think they are synergistic. They work together, and it's seamless. He does the technical aspect, she does the physio aspect, the rehab aspect. So I think it's a very, very good combination. And if they have created a child, that has to be good.
Dr. Sharan, when I first met him at Tokyo, probably in 2015? 15. Firstly, I'm really impressed by his attitude to the work, and he always worked so hard, always studied so hard at night. So every neurosurgeon at our hospital really surprised his attitude to the how to study, how to learn what he wanted to know, what he wanted to study, functional neurosurgery. That's my good. That's one of my good impressions of Dr. Sharan. And he, of course, he is my best Indian friend, best friend in the world. So, and he is also my teacher. He taught me and teaches me the neurosurgery or politics, but also for life and for how to enjoy life. So yesterday also you told me everything. So I was really impressed by his experience and his thought, how to enjoy life, how to decide, how to think the future. So I really admire his way of thinking and his behavior to others. He's so interesting, so funny, and so friendly to anybody. Anybody. So that's the best, one of the best functional neurosurgeon in the world, not in India, in the world.
Thank you.
I believe he will be the one of the best leaders in the functional neurosurgical society, but also functional neuroscience. Yes. So I hope we will make a better future together for the patients and the patient family.
Yeah, I think teamwork, as in, I would say that from your ward boys to your paramedical to your nursing to your junior residents, your junior consultants, your senior consultants, I think it's all a team game. And even when you talk about neuro rehab, I think you need to have the speech therapist, your occupational therapist, your people doing the pulmonary rehab, the neuro rehab. So I think it's all a part of a team, and it is only when you all the departments are working as one cohesive unit, I think that is the time when you normally get the best results out. And I still strongly and firmly believe that all this is a team science, and we have always believed in multidisciplinary team approach. There are no egos involved in this.
I have been associated with Dr. Sharan almost since last 15 years, and I have been associated in taking care of his neurorehabilitation team as a physician and as a consultant intensivist and as a friend also. What I would say with respect to Dr. Sharan's neurorehabilitation team is that it is not just the physiotherapy who gets involved, it is not just the limb movements that happens, it is the multidisciplinary approach that what Dr. Sharan has incorporated into his team. So that means that a patient may require the ICU care, patient may require the further investigations, specialty care, super specialty care. So all these things are made available in one single room, especially at Bhagwan Mahavir Jain Hospital. And of course, that Sharan has got a very good clinical skills, very good neurosurgical skills, and he is specialized in many of the brain surgeries also. And so we generally say that yes, we see him more in the newspaper, TV channel than what we could see him in physical here. That's a joke. But yes, we share a good rapport with Dr. Sharan.
My association with Dr. Sharan goes back to close to a decade. I have been associated as an anesthesiology colleague with him. Of course, his passion as far as neurorehabilitation is concerned, which I consider a unique strength, which is not generally found, which matter of fact a common man looks for, which is a very rare services being offered, I consider is one of the unique services Dr. Sharan is offering for particularly common public.
Under Dr. Sharan's advice, we were able to get those patients back. ಅಂದರೆ ವೆಂಟಿಲೇಟ್ರಿಂದ ವೀನ್ ಮಾಡೋಕ್ಕೆ ಸಾಧ್ಯ ಆಯಿತು. ಯಾಕೆಂದರೆ He is so much experienced, not only about neurosurgery, he overall system he knows. He used to guide us and he used to tell us, be patient, have patience, and ಏನಕ್ಕೆ ಹೈಪರ್ ವೆಂಟಿಲೇಟ್ ಆಗ್ತಾರೋ ಇಲ್ಲ ವೆಂಟಿಲೇಟ್ರಿಂದ ಯಾಕೆ ಬರ್ತಾ ಇಲ್ಲ ಅದಕ್ಕೆಲ್ಲ ರೀಸನ್ಸ್ he used to have. He used to guide us, sir. With his guidance, many of the patients, they have come out of the ventilator, they have gone to ward, and they tracheostomy ಇದ್ರೂ ಕೂಡ ಕ್ಲೋಸ್ ಮಾಡಿ ಮನೆಗೆ ಹೋಗಿದ್ದಾರೆ. So these results I have seen here, because follow up ಇಲ್ಲಿ ನ್ಯೂರೋ ಕೇಸ್ಗೆ ಫಾಲೋ ಅಪ್ ಚೆನ್ನಾಗಿದೆ ಇಲ್ಲಿ. These people, they are trained to do that. It's very much different from normal physiotherapy. ಈಗ ಫಿಸಿಯೋಥೆರಪಿ ಈಗ ನಾವು ನಾರ್ಮಲಾಗಿ ಯಾವುದೋ ವೆಂಟಿಲೇಟರ್ ಪೇಷಂಟಿಗೆ ಕೊಡ್ತೀವಿ ಅಂದ್ಕೊಳ್ಳಿ, ದೇಲ್ ಜಸ್ಟ್ ಡಿ ವಿ ಟಿ ದಿಸ್ ಪ್ರೊಫ್ಲಾಕ್ಸಿಸ್ಗೋಸ್ಕರ ನಾವೆಲ್ಲ ಹಾಕಿದ್ರೂ ಲಿಂಬ್ ಎಕ್ಸಸೈಸ್ ಎಲ್ಲ ಮಾಡಿಸ್ತಾರೆ. ಬಟ್ ಇವ್ರದ್ದು ಹಂಗಲ್ಲ, ಓವರ್ ಫ್ರಮ್ ಹೆಡ್ ಟು ಟೋ ದೇ ವಿಲ್ ಡು. ನ್ಯೂರೋ ರಿಹ್ಯಾಬ್ ಬಗ್ಗೆ ನಾನು ಒಂದು ಮಾತು ಹೇಳಿದ್ದು ಅಂದರೆ, ಇಟ್ಸ್ ರಿಯಲಿ ಹ್ಯಾಟ್ಸ್ ಆಫ್ ಟು ಡಾಕ್ಟರ್ ಪ್ರತಿಭಾ. ಅದು ತುಂಬ ಚೆನ್ನಾಗಿ ನಡೀತಾ ಇದೆ ಸರ್. ಮೆನಿ ಪೇಷಂಟ್ಸ್ ಸರ್, ನನಗೆ ಲೆಕ್ಕ ಇಲ್ಲ ಆ್ಯಕ್ಚುಲಿ. ನಾನು ಬಂದೆ ಲಾಸ್ಟ್ ಸೆಪ್ಟೆಂಬರ್ ಬಂದಿದ್ದು, ಎಷ್ಟು ಜನ ರಿಕವರಿ ಆಗಿ ಹೋಗಿದ್ದಾರೆ ಅಂತ ಲೆಕ್ಕ ಇಲ್ಲ, ಅಷ್ಟು ಚೆನ್ನಾಗಿ. ಇಟ್ಸ್ ರಿಯಲಿ ಗುಡ್ ಆ್ಯಂಡ್ ಡೆಫಿನೆಟ್ಲಿ ಇಟ್ ಶುಡ್ ಕಮ್ ಅಪ್. ಅವೇರ್ನೆಸ್ ಬೇಕು, ಜನಕ್ಕೆ ಅವೇರ್ನೆಸ್ ಬೇಕು. ಏನಂತಾರೆ ಅಂದರೆ ಮನೇಲೇ ಇದ್ದರೆ ಫಿಸಿಯೋಥೆರಪಿ ಮಾಡಿಸ್ಕೊಬಿಡ್ಬೋದು ಹಾಗೆ ಹೇಗೆ ಅಂತಾರೆ. 1 or 2 months ದೇ ವಿಲ್ ಜಸ್ಟ್ ಗೆಟ್ ಮಚ್ ಬೆಟರ್ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್.
And I would refer you to one Dr. Sharan Srinivas, who generally he's a neurosurgeon, and he is at the Jain Hospital. So he immediately gave me his number. Then I happened to call Dr. Sharan. So he said, come over, let's have a discussion. So that's when I rushed to Jain on the 1st of May 2020. So once I met Dr. Sharan and I explained to him about what had happened in the 3 months of hospitalization, we had a 15 to 20 minutes discussion. He was very patient enough to listen to all my problems that my son was going through, and that and his one question to me, which still sounds just, what do you want from my side and things. So I said, in a normal, any parent for the matter says, I want my son back. He says, I'm going to give it the 100%. No, I'll put in my efforts, my team will put in the efforts, please bring them over. But I generally made that small mistake that, since my son was on a ventilator, shifting him during the COVID period would have, would be riskier. So I took another 30 odd days to come. So next that I came to Dr. Sharan was on the 2nd of June. Then he said, Mahesh, don't please delay, get him. So 3rd of June is when I came to Jain Hospital, and my son from there was treated by Dr. Sharan. And for me today, if I have to say, it's like God said thing. I thank that particular doctor who referred me to Dr. Sharan. And today, what my son is only because of Dr. Sharan and his team. Sir.
Okay.
Hi, my name is Tarun. I would like to thank 3 people, he says. One, my father, that's me. 2, my mom. 3, Dr. Sharan.